Good morning, viewers, and welcome back to the Tobago Updates morning show, coming to you here live from the Port Mall in Scarborough, Tobago. Yes, viewers, in this segment, we are chatting with a Deputy Chief Secretary and Secretary with Responsibility for the Division of Health, Dr. Faith B.Yisrael. Good morning to you and welcome.
Good morning, Julien. Thanks for having me. It's wonderful being here.
All right, so as we get the conversation started this morning, we are speaking to current, very topical in our space. Quite recently, we saw press releases coming out from the ministry advising that it's officially here in Trinidad and Tobago, Mpox, monkeypox. We want to get from the Tobago perspective, where are we at? And just before we go into our preparatory mode, because we know that you all have headed into certain meetings, and so in preparation, we want you to begin and to start from, I like to reference from your background in terms of public health. For those who are not aware, I want to believe that there are some misconceptions out there in terms of, tell us a little bit about Mpox and monkeypox.
Certainly. So, yes, we are here. We started preparing for this since last year when we recognized that Mpox, well, formerly known as monkeypox, we kind of interchanged them, started happening in areas outside of where they traditionally occurred. So they traditionally happened within West African countries for many, many years. It's been a normal thing in West African countries. Last year, though, we recognized that there were individuals in other countries outside of the traditional areas where they were popping up. So what is Mpox? It's actually a virus that is spread from person to person. Well, the original description of it says that it was actually spread from animal to person. But now that it is in the human population, it spreads from person to person. And it's important for us to recognize this because I see a lot of people speaking about it as if it is the same as COVID, but it is not the same as COVID in terms of how it is actually spread. You need actual close physical contact with someone as the primary way of spreading. So we encourage people to be careful of somebody who you may be kissing or someone who you may be having very close facial contact with or bodily contact, skin to skin contact, in the normal sense that usually happens with a close sexual partner is who that happens with. Or if you are in a household, somebody who you are hugging, somebody who you may be sleeping on the same bed with. So those are the areas where we are encouraging people to be a little cautious because that is how it is actually spread. It also is spread primarily. I mean, we say pox. When we think of pox, traditionally it's a term we use, meaning having a lesion of some sort on your body. It is actually the virus is most concentrated in the fluids that come out of the lesions. We all know if you have a little cut, it usually springs a little bit of water, or the pox springs a little bit of fluid, and it is in that fluid that you see the most concentration of the virus. It also is in other bodily fluids as well, but that is the one that is most critical for us. And if that fluid then comes into contact with a broken skin, a mucosal lining, so it gets into your mouth, your nose, that kind of thing, or it gets onto your skin and you have a broken skin, then you can contract Mpox. So what are the signs and symptoms? The good or bad thing about Mpox is that other than the rash and or the pox, other than that lesion that you see on your skin, it actually looks like so many other illnesses. So you get a fever, you feel lethargic, you may have those things that happen when you start feeling like you're getting a flu kind of thing. That is how you feel. So it really requires you to come in to get a sample taken, and they take the sample from the lesion, get the sample taken, and that sample is then sent to be tested. It's the same PCR testing that we are doing for COVID, is the same kind of testing that is done to it. And that is when we would be able to say, yes, this person does actually have Mpox.
So I want us to get in a little bit more. You've touched there on the symptoms and kind of giving a very broad idea to make that distinction so people don't take it immediately for COVID. Because I hear persons speaking about, whether or not we got to go back to wearing masks and a number of other things in terms of having that misconception. But give us an idea in terms of what are the global statistics looking like? What kind of situation are we facing from the broader perspective before we begin to even touch home, where we have now seen our first case in Trinidad and Tobago?
Right. So we have a couple hundred thousands in the world. But when it comes to what's important to know, though, is that the cases are usually very mild. So that's another thing that we need to be very, very conscious of. In the world, we've had a little over 100 or so, 112 or so people who have died from it. So the number of people who've died is very small, especially compared to, COVIDs. We were talking about hundreds of thousands and millions of people all over the world who are getting very sick and dying from COVID. But as it relates to Mpox, usually the cases are usually very mild. So it's important to know that, which is why it is something that we will not, ideally, because we haven't seen it in any other areas of the world just yet, we will not get to the point of having to do a complete lockdown, for example, the way we thought of COVID, or the way we had to function because of COVID. Again, that goes back to the way it is spread. So remember, in COVID, somebody could have coughed, for example, that would allow the droplets to go into the air, to land on surfaces and so forth. And then somebody else coming into contact with that quote unquote contaminated air, they could have gotten infected. And that is why we were telling people to wear their mask, because the mask was for you who may be infected, to prevent you from infecting others, or for those who may not have been infected, to prevent them from getting it. But with Mpox, because it is really from the fluids of those lesions, it means you have to really come into close contact. So it's not casual contact. It needs to be close contact, face to face, skin to skin. You may actually also contract it. Let's just say somebody is sleeping in a bed, they have it, the fluids ran off from them onto the sheets, and then somebody else comes and lie down directly on the sheet and that kind of thing. So the transfer is in those kinds of settings, but not the regular, you and I are just sitting here a little bit apart. This is not a concern really to each other, which is why we are not going through the route of the isolation and quarantining and stuff like that the way we did before. We would, though, encourage individuals, if you know you have Mpox and you are in close contact, because you do find some of the virus in your mucosal lining, we do encourage you to also wear a mask, though, if you are coming into close contact with other people, like in your house and that kind of thing. So wear the mask in your house to protect the others from who are within your home from contracting.
All right. Tell us a little bit very quickly in terms of, would you describe Mpox as deadly, especially when we make the comparison with the most recent in terms of the COVID experience?
No, certainly. The number of individuals who die from Mpox is really, really very, 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 very low. And we've recognized that those individuals who die are those who really have, we're going back to that word that we were using for COVID, comorbidities, meaning you have another disease and your body is generally weaker. So your body isn't able to fight off. So you may have an autoimmune disease, you may have, like HIV or something like that, or you may have another type of cancer or some other kind of disease that is causing your body to not be able to fight off the Mpox as easily as everyone else. But for the vast majority of people, it is a relatively mild disease. And because it is a relatively mild disease, the treatment is also relatively simple. The treatment usually includes basically just treating the symptoms that you may have. So headache is one of the symptoms. So you get something, a painkiller for your headache. Fever is one of the symptoms. You get something for the fever. Sore throat is one of the symptoms. You take something for the sore throat. Yes, even though it is a virus, there are antiviral medications for it. But those are very expensive, and that is not the normal route for treating something like this, particularly since it is not as deadly as COVID was or many of the other viral
All right.
diseases.
Let's get into the preparation of our healthcare system here in Tobago in terms of readiness for. Tell us about some of those specific efforts.
Certainly. Well, the good thing about this is that we started preparing since last year. So we had gone into all of the entities, as in within the TRHA, even within the other areas, the tourism sector and so forth. This is kind of what you do if this happens. So when we got the case last week, and we now officially, as of up to this morning, officially 2 cases in Trinidad and Tobago, when we heard about that, what we did was basically call everybody together and say, okay, remember last year when we were going through all of this rigmarole story where we were documenting who does what and that kind of thing. Let us just pull those back up, look at those policies again, see if they still make sense, because you never know, a couple months have passed, close to a year has passed. Let's see if we need to tweak anything. And if we don't really need to tweak anything, let's just run with that, which is what we are doing. So the teams actually were meeting last week to go through what was there, to see whether something needed to be tweaked or not. And we recognize that most of the things are fine, so let's just run with the policies. So what is it? If you think that you have one of those symptoms, particularly if you are seeing a pox, a lesion, or something like that, definitely you can call 211 to get the ambulance. You can call 800-HEAL, which is the same number we were using last year for COVID, and say, you know what, this is a situation. Let me come and come to the health facility. The professional there will take you and get a sample. And the sample usually comes from the lesion. So the lesion might be on your hand, on your face, on your genitals, your anus. They'll take that sample, contact the Office of the County Medical Officer of Health, the CMOH, and then transport that to Trinidad to get it tested and go through that normal process. For the vast majority of people, as I said before, the disease is relatively mild, so you may not need to be hospitalized, for example, because you are not sick enough to be in the hospital. If you do need to be hospitalized, we are going back to having people at the fort, which is where we had people for COVID and so forth. If you absolutely need to be hospitalized, that is an option. But for the vast majority of people, you really would not need to be hospitalized. You could just treat with the fever, treat with the sore throat and so forth. What we are encouraging you to do, though, is to definitely stay isolated. So even if you are not hospitalized and you are at home, stay isolated at home so that you do not pass it on to others who are in your home.
So just to be clear, so it's not a case where persons are being encouraged to come to report to the healthcare facility. So in the event that you call an ambulance, you call for that kind of support, the response isn't as quick enough for you. Is there any way that they report? So how are we treating with that specific to, during the COVID, we had a situation where you get up to the hospital, you go through that processing on the outside before to know whether or not you stay with accident and emergency and so on. Just give us a little bit more, a more specific idea in terms of that process.
Right. So the same thing does apply for this. If you are not ill enough to think that you need to call the hospital or to call an ambulance, for example, you can make your way to a health facility, and they are aware of these are the things you need to look for. What we recognize is, again, because this is an infection that passes through close personal contact, it is actually picked up quite a bit in the STI clinics. Because again, you happen to be coming for some other STI and we recognize you have that lesion, you have that thing. Let's look at that as well. So we have actually been sensitizing the physicians, the health professionals in the different areas. Even if somebody comes for something else and you notice this thing, alert us, let us know, go through the protocols, take the samples, and then we would go from there. If you have any questions at all, call the 800 HEAL number, and then they could walk you through, okay, this is the best place to go. We have, limited volumes of people in this facility versus that one. So go to this one instead of that one. You don't necessarily need to go up A&E. You could probably go to the health promotion clinic or another space that may have a less volume of people to treat with. So that's why we're encouraging people, even if you have these symptoms, call the number, get your questions answered, and we'll go from there.
Will it be a similar situation in terms of isolation, depending on the severity? Persons are required to stay at the health facility, or is it a case that persons can isolate at home? How is that being, what's the proposal to treat with that?
Right, so if you are not feeling very sick, you can isolate at home. The thing that so remember, for COVID, we were actually saying you needed to be separated, and then those your close contacts with, then they needed to be quarantined and that kind of stuff. We're not even doing that at this point. We are just saying, yes, you, the individual who are the case, if you are the case, as long as you're not very, very sick, you can isolate at home. Your family members, be cautious, be careful, try to stay away, stay in your own bedroom and that kind of stuff. We are not saying to them that they also have to quarantine or anything like that at this point. So we're just telling you, be cautious. If you know that you have it, definitely let people who you've been close with. So if you know you have it, or you recognize you have these signs and symptoms, call the person who you probably had a close personal contact, i.e. possibly sex, last week or so. Let them know this is a situation so they can also be conscious, and we go from there.
All right. One of the things we want to give us an idea of the duration. I know it may not be specific in nature, but generally, the process of somebody, getting into contact with the virus, becoming affected, seeing signs and symptoms, going through the process of being cared for, and getting back to the point of recovery.
Yeah. So on average, an individual can see themselves with the pox clearing up. So after you get ill, you get the pox, it things a little bit. You actually see then scabs. The typical, when you get cut in a scab, that scab falling off is really the sign that you are in a better place. You now have new skin. That process usually takes about 2 to 4 weeks to get to that process. So that is the window we are really giving individuals. Again, it takes about 2 to 4 weeks for it to get to the point where the scab has actually fallen off and you now have new skin, fresh skin covering that spot. That's about 2 to 4 weeks.
All right. Any information out there or plans specific at that in terms of considerations for vaccines?
Yes. So the thing about that is that we do have vaccines. The minister last week indicated that there are vaccines in the country, but we are again limiting who the vaccines are for. This is not going to be a mass vaccination drive or anything like that. If you think, for example, that you are a close contact of someone who has Mpox, so somebody called you, they said, hey, I have Mpox, and you had close interaction with them, you are allowed to come and get the vaccine, because the vaccine is going to help you not seroconvert, not get it, in essence. We are also encouraging healthcare workers who are in the spaces where this is being treated with, where this is being dealt with. We're encouraging them to also get the vaccine. So these are the two main categories of people who we are encouraging to get the vaccine. But the vaccines are available. And once you fall into those two categories, we're encouraging you to get it.
Before it slips me very quickly before we close, impact on children, particularly being back out into that very close kind of physical space, concerns that parents may have. What's the research saying in relation to the impact on children?
Well, the number of children with it is relatively small, even worldwide. Again, we are going back to how you get it. So there may be a situation, for example, where a mother who is hugging and kissing and so forth their child can transmit it to their child, or somebody who is giving birth. The process of childbirth, you can also contract it through childbirth. But other than that, the number of cases in children are very small, and children, like adults, are recovering relatively easily, relatively quickly from Mpox. So it is not something that we need to be too concerned about. Of course, if you have Mpox, and you have lesions, and your child has Mpox and has lesions, you definitely don't want to send them to school and that kind of stuff. Let's just basic common sense in terms of how we roll out these things. But we need to not be as let's not panic. We're not going down the road of a whole pandemic anymore and that kind of thing. It is easily manageable. We just need individuals who may be a case because they have the sore throat, the headache, those things, particularly if on top of those things that we would see, because you realize that's for most colds, coughs, that kind of thing. If you recognize you also have the rash and the pox, definitely let us know. And as soon as you recognize you have that additional thing, let us know, 800-HEAL, and definitely isolate yourself from others, because that is when you are most infectious.
All right. Thank you very much there, Dr. Faith B.Yisrael, Secretary with Responsibility for Health, just giving us a little insight and seeking to put the minds of many at ease. Yes, we've got to be responsible at this time, treating with the entry of this virus into Trinidad and Tobago. But at the same time, it's important for us to understand the processes and to understand what we are treating with in this circumstance. Of course, in the coming days, we anticipate, and in the coming weeks, that we'll be having further conversations and follow-ups within the healthcare system to put persons into that position. But as it stands now, the contact information is 800-HEAL that you can continue to reach out to, or you can contact 211 in the circumstances as your initial response if you have any concerns at all at this time with regards to what you might be observing, persons that you may be interacting with, or even yourself under the circumstances. So thank you very much again, Dr. Faith B.Yisrael, for joining us here on set this morning. Viewers, we want to thank you so much for continuing to choose the Tobago Updates morning show, and to remind you that this is your opportunity to share the live, share the live, share the live.